It appears that the coronavirus is devastating areas of the country that have voted for President Trump. A newly released, a newly leaked, unreleased White House coronavirus task force report is now showing COVID-19 cases exploding in areas where Trump did very well in 2016. Now, this report obtained by NBC News shows that some parts of the country, rural counties in Tennessee and Kansas, thought to be, of course, untouched. In fact, a lot of the justification for opening up other parts of the country is to say, well, look, hey, man, look, these places, they're not hotspots like New York, LA, and Seattle. No, 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 no. These places are untouched. So why should they be closed? Well, why do we have to close down this part of the country when, we're not really affected here? Probably explains why this report was hidden by the coronavirus task force, because it completely undermines that argument of we can reopen some parts of the country because it's not here. Oh, it wasn't there at the time. It wasn't there yet. But the nature of this virus means that it will eventually get there and start infecting, and already it has. In fact, these places, these counties in Tennessee and Kansas, have seen cases balloon by over 1,000% in the matter of a single week. 1,000%. In other counties in Missouri, Nebraska, Minnesota, and Wisconsin, they saw increases of more than 400%. This, of course, while cases in other 14 states have decreased thanks to state lockdowns, mask rules, social distancing, all that. In fact, social distancing has been incredibly effective at staying off the virus, at actually flattening the curve in a lot of these states. And of course, some of these states have seen lots of protests. For example, Michigan continues to have protests. We have some of the more strict lockdown rules. And it's because we had a really, really high spike in infections. Now we're doing social distancing, and actually we're starting to control that to flatten that curve, but we're not quite there yet. And yet we have people in the more rural parts of the state that are saying, well, I haven't come here, so why don't we open up the state? Some tyranny, right? Got to water the tree of freedom with the blood of tyrants. Oh, is that what we're gonna do? Is that what you're doing right now? No, you're gonna end up watering it with your own blood when you're choking on your own fluids in the hospital. That's what's going to happen. Keeping it real. It's not fear mongering. That's literally what's happening to people. Just ask the people in these counties who thought, no, it's not gonna come here. It's not here. No, we're fine. These small communities, yes, they're initially not affected in the first wave. But once one person gets into that community, that entire community then gets that virus. And in a lot of cases, the infrastructures of those communities are not set up to handle everyone getting sick. And so that's going to lead to, of course, more death. So it's absolutely ridiculous. So you got people, places that have been hit first that are starting to recover, right? That are doing the social distancing measures. But you have other states that we don't really know where they stand because they don't have widespread testing. So you have those states that you can see a definite undercounting of COVID-19 cases. So we don't know where they're at. So now, look, there's a big takeaway here from this report. And in fact, there's quite a few. And part of it goes to why it was unreleased. It shows that the president was wrong when he claimed that numbers across the country are going down. In some places, yes, they are, as I mentioned, but in a lot of places, we just don't have testing. And that some of the hardest hit places are now in Trump country. Whereas before, remember, originally it hit a lot of these big cities. And so a lot of these big cities especially hit hard in places that are minority inhabited, right? So you have a lot of minorities in these areas that are getting hit the hardest. So now the Trump bumpkins, they don't care, right? Like, oh, it's the minority areas. I don't give a crap, right? Not only do we not like minorities, But, look, we're unaffected right now. So who cares? Open up the country. Open it up. Open it up. I need to get a haircut. I need to go and, with my buddies, with my strap on my. No, no, don't go there. Right. I was going to say, put on my rocket or my bazooka, right, on my back, and my AR-15, my long guns. I'm going to go to Subway with Meal Team 6 because we're unaffected. Open it up. I need a haircut, right? So those areas, you have those protests, which, by the way, they're starting to wind down a bit because now you have the backers that are wealthy that have funded this that have backed off on that funding. Now they don't care as much, right? Because it is hitting these white areas. It is hitting these rural areas. And it turns out, oops, protesters were wrong. Now, who was saying that from the beginning? All the experts. Everybody who's listening to the doctors and is listening to the people who actually know what they're talking about, we're like, yeah, of course, we knew this was going to happen. So that's one takeaway, right? Dr. John Ross, a professor at Harvard Medical School, pointed this out, that one of the top 10 counties that saw the largest increases, again, after releasing these social distancing measures and, letting people go back and get haircuts and massages and all that stuff, these places have seen the largest increases, and they happen to correspond with counties that voted for President Donald Trump. The top 10 cities in the report, which was produced on May 7th, saw cases increase by more than 72% over 7 days. Some areas like St. Louis and Central City, Kentucky, saw cases skyrocket by 650% over that span. St. Cloud, Minnesota, saw cases increase by more than 400%. Other cities like Gainesville, Georgia, Racine, Wisconsin, and Nashville saw increases of more than 100% over a single week. Now, a separate graph listing locations to watch include Kansas City, Missouri, and Charlotte, North Carolina, which saw increases of more than 200% over the previous week. That report, by the way, this was by the Trump administration, the coronavirus task force, right, found that statewide cases in Minnesota increased by nearly 100% over a single week, while in New Mexico, Tennessee, Wisconsin, and the nation's capital saw increases of more than 40%. Oops. Are we at all surprised? Look, the reason that we link this to Donald Trump and his behavior, right? He's been out there saying, it's going to disappear. We don't even need a vaccine. In fact, we're winning the war on the coronavirus. Everything's going to be fine. Not a big deal. In fact, he's subscribing to the idea that the death counts are overcounted. Now, that doesn't actually fit up with the reality. But what Donald Trump does in denying the science, of course, so he accomplishes a couple of things. For one, he's trying to make the case that everything's going to be fine, so vote for me, right? We're going to have an economic recovery like you've never even seen, and it's only this overblown virus, right? It's overblown by the media to make me look bad. Well, that's not the reality. No, I'm actually doing a fantastic job. While the media is calling out my failures, they're not actually failures. No, it's the media that's lying to you about this stuff. It's actually not that bad. Therefore, I deserve to be reelected, right? Well, no, that's not the truth. But he compounds this by sending the message that you shouldn't be socially distancing and you shouldn't be wearing masks. He never wears a mask. Mike Pence doesn't wear a mask. And in fact, told people, meatpacking industry executives, or I should say food industry executives, not just in meatpacking, in a meeting over the weekend, he told them, oh, no, remove your masks. Like, when Mike Pence comes in, you should not be wearing a mask because he's not going to wear a mask. And so nobody's wearing masks. He's not enforcing people to wear masks at the White House, even though there is now a directive in the White House. He's still not wearing them. And the people that are only doing it for the camera. And so what message does that send? Ignore the doctor's advice. You got Rand Paul out there saying, the doctors really don't know anything. They're not The so-called experts, they're not really experts about everything, so you can just ignore them. Just ignore them. That they don't know everything. Okay, but do you? Rand Paul himself was a doctor, right? Apparently, not a very good one. I mean, it's ridiculous, right? So now the medical professionals are saying we're not even near done with this. In fact, some of them slammed Trump's recent attempts at spinning these rising death counts. Quote, anybody that claims we're on a downward trajectory nationally is out of touch with reality. Again, that's what Donald Trump had claimed. We get the cases that are falling. We're winning. We're doing very tremendous in this war against the coronavirus. Well, Dr. Irwin Redliner says, nope, no, you're not. You're out of touch with reality. Now, this guy is the director of the Columbia University National Center for Disaster Preparedness. And I would say that, of course, it's a disaster. He told NBC News that even the rising numbers in these areas are not telling the full story. Quote, there isn't a single state in the union that has sufficient testing. And again, you can blame the administration for that, for not getting out enough tests federally, and also not funding this as they should be. Remember, state governments only have so much money, right? They can't borrow like the federal government can. Only they can be funded by the federal government, which of course the Trump administration continues to try to stop them from doing, right? Now he says, quote, it's not appropriate to say the U.S. is consistently on a downward trend at all. In some places, it might be the direct opposite of that. And we've seen that. So now the response from conservatives, as I mentioned before, from Donald Trump, is that, well, you're just overcounting. I mean, there's a conspiracy that's floated by Fox News and the right wing that anybody who's died recently, right, is getting tagged as having died from coronavirus, even if that's not specifically the case, right? Oh, guy died of a heart attack, coronavirus. Guy died of he got his head crushed by a tractor or whatever. He got hit by a car. Coronavirus. That they literally believe this. That, oh yeah, of course, that anybody who dies, they're tagging with coronavirus. Why would they do that? Well, it's because hospitals are getting more funding for people who die from COVID. They're literally getting money. So they're just tagging everything with COVID so they can get that extra sweet government cash. Really? Now look, hospitals are getting compensated more for coronavirus patients because of the amount of care that is necessary for someone who gets COVID-19. Remember, we don't necessarily have a treatment for it, right? And the use of a ventilator, I got news for you. That's expensive. To treat these victims of coronavirus, it also takes a lot of PPE, right? That's not free. No, it takes money to be able to outfit doctors who and nurses who treat coronavirus patients to make sure that they sterilize everything that they can around that area. So yes, the federal government is giving hospitals more money for COVID patients because it takes more money to treat COVID patients. Duh. I mean, anybody who takes like 5 minutes to think about this stuff and factor in everything that is involved with treating coronavirus patients thinks, oh yeah, you know what? It kind of does make sense. It is kind of expensive. And so the federal government has, yes, reimbursed the hospitals and given them money to treat coronavirus patients. That doesn't mean that it's an incentive to label everything as coronavirus related or all those deaths. So it's a ridiculous conspiracy theory, right? I mean, not only is that a ridiculous theory, right, that we're overcounting deaths, the reality is that early on, especially, we've actually undercounted. We didn't know that coronavirus, that it was killing people. People that show up at the hospital with symptoms, we didn't know. We didn't know what it was. Not only that, but there were people in their homes that died of coronavirus that we still don't know, or we didn't know the cause, that had been what had killed them. And so, yes, it is undercounted. In fact, Dr. Anthony Fauci, during a his testimony to a Senate committee on Tuesday said, quote, most of us feel that the number of deaths are likely higher than the 80,000 currently reported. The number is likely higher. I don't know exactly what percent higher, but it's almost certainly it's higher. Now, look, does it make a huge difference if it's 5 or 2% higher? I mean, a little bit, yes. But the fact is that the Trump administration, the problem is the Trump administration has done everything in their power to stop us from adequately addressing this crisis. So that 2 to 5%, it's actually, maybe it could be 20% higher, the death toll, than it could have been had we had a competent government. And so that's the thing. The Trump administration has absolutely dropped the ball, but they're doing this. I mean, it almost feels like they're doing this on purpose, right? That they're making sure that more people, I don't know, are affected. More people are exposed to this because they don't want to deal with it. They don't want to do what's necessary to deal with it. And I guess they consider a large portion of the American populace expendable. I mean, they've been calling for this. They've been calling to open up the country. And we're not ready. We're not ready to open up the country. But in conservative states, this is what you're seeing. This is what you get for disregarding the scientists and the medical professionals. I mean, it shouldn't be surprised. I mean, that you have a gigantic spike in cases. I mean, conservatives, this is what you wanted, right? Sacrifice a week so Karen can get a haircut. Why was the administration hiding the report? Why were they sitting on the report? I mean, you should be proud of the death toll. It's cost freedom. You get your haircut with the side of COVID-19. Freedom. Tree of liberty. Tree of liberty. I mean, look, these people, they didn't believe that coronavirus was real. They said it was a hoax, or they believe it's overblown, or, well, now you got 1,000% increase in Tennessee. And likely that's going to get higher. More people are tested, right? As we expand testing. And we need to expand aggressive testing and contact tracing. It's the only way that we're going to beat this, right? But this is a result of willful ignorance and social Darwinism on the part of the Republican Party. They are a death cult. So you shouldn't be surprised when there's a lot more death with them in charge. Hey guys, hopefully you enjoyed that free video. Now I'm going to have to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a Patreon, patreon.com/TYTNation, set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, you know the show. You know how I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent progressive media.